In today's video, we're tackling something that affects millions of people: cataracts. Have you noticed your vision changing recently? Maybe things look a bit foggy or blurry, especially at night? If that sounds familiar, you might be wondering if cataracts are the cause. Don't worry, you're definitely not alone. Cataracts are a common issue, particularly as we get older, but here's the good news. There are steps you can take to protect your vision, and if cataracts are already starting to develop, there are treatments available. We'll cover everything you need to know about cataracts: what causes them, what symptoms to watch out for, and how to prevent them from affecting your daily life. We'll also explore the latest treatment options, including surgery, and walk you through what to expect during recovery. Whether you've just started noticing changes in your eyesight or you're already considering treatment, this video has plenty of helpful tips to keep your vision healthy for years to come. Ready to learn how to protect your eyesight and even reverse some of the damage that's already been done? Topic 1. What are cataracts? Cataracts. What exactly are they? If you're wondering, is this something serious? The good news is that cataracts are actually pretty common, especially as we age. Imagine this: your eye's natural lens, which is usually clear, starts to get cloudy. It's like when your glasses fog up, except this time, the fog doesn't clear up. That's essentially what a cataract is: a slow clouding of the lens that affects how light enters your eye, making everything appear blurry, hazy, or even like you're looking through a foggy window. The thing is, cataracts don't show up overnight. They develop gradually, often over years, which means you might not notice the changes at first. You might start squinting more than usual, or notice that your vision isn't as sharp as it used to be. For many people, the first signs are subtle: a little bit of blurry vision here, maybe some halos around lights there. But over time, these symptoms can start to get in the way of everyday tasks like reading or driving, especially at night. It's not unusual for people to need brighter lighting to do things that used to be easy. The tricky part is, sometimes cataracts develop so slowly that you don't even realize it's happening until it becomes harder to see clearly. So, what are the classic signs to look out for? If you're experiencing blurred or cloudy vision, halos around lights, especially at night, or trouble seeing in low-light situations, it could be a sign of cataracts. If any of this sounds familiar, it's a good idea to see an eye doctor. Don't just shrug it off. Getting a professional opinion can make a big difference, especially if you're noticing these symptoms. After all, catching cataracts early gives you the best chance at managing them effectively. So, how exactly do cataracts develop in the first place? Topic 2. Why do cataracts develop? Cataracts might seem a bit mysterious, but the truth is they actually have a pretty simple cause. They happen when the proteins in your eye's lens start to break down and clump together. As we age, this process naturally occurs, and it creates a cloudy patch in the lens. It's like when a clear window gets dirty, making it harder to see through. Unfortunately, this is a normal part of getting older, but age isn't the only factor in cataract development. There are a few things that can speed up the process. Genetics, for example, plays a big role. If your parents or grandparents had cataracts, you might be more likely to develop them too. But that's not all. Conditions like diabetes can also increase your risk. High blood sugar levels can cause your eye's lens to swell, leading to clouding over time. Exposure to UV light is another big factor, which is why wearing sunglasses is so important. And if you smoke? Unfortunately, that's a risk factor too. Smoking not only damages your lungs but your eyes as well, partly because of the toxins in cigarette smoke. Even certain medications, like steroids, can contribute to cataract development. While it's completely normal for cataracts to form as we age, that doesn't mean you have to just accept it. You don't have to sit back and wait for it to happen. With the right steps, you can slow down the process and even reduce the risk of cataracts forming too quickly. So, how can you protect your eyes? Topic 3. Prevention. Can you avoid cataracts? Now, let's talk about prevention. Can you actually avoid cataracts? While we can't completely stop them from forming, the good news is there are plenty of practical steps you can take to reduce your risk. Think of it like taking care of your eye health, the same way you'd look after your heart or joints. Small changes can make a big difference over time. First off, one of the simplest and most effective things you can do is protect your eyes from UV light. That means wearing sunglasses with UV protection every time you head outside. You might not realize it, but those harmful UV rays can do a lot of damage over the years. Even on cloudy days, UV rays are still there, so don't skip the shades. A brimmed hat can also be a great addition to help shield your eyes from direct sunlight. Next up is your diet. What you eat plays a huge role in your eye health. Aim to fill your plate with leafy greens, carrots, and fruits rich in vitamin C. These foods are packed with antioxidants, which help protect your eyes from oxidative stress. Spinach, kale, and even broccoli are excellent choices. Not only do they support your eye health, but they'll keep you feeling good all around. And don't forget about vitamin C. Foods like oranges, strawberries, and bell peppers are great for keeping your eyes in top shape. If you smoke, here's a bit of tough love. Quitting is one of the best things you can do for your eye health. Smoking accelerates the aging process in your body, including your eyes. It harms the blood vessels that deliver oxygen and nutrients to your eyes, which speeds up cataract formation. The good news? It's never too late to quit. Whether you've been smoking for years or just a few months, stopping now can still make a huge difference for your eyes. Finally, if you have diabetes, managing your blood sugar is key. High blood sugar can lead to cataracts developing more quickly, so keeping your blood sugar in check through medication, diet, and exercise can help slow things down. Making lifestyle changes isn't always easy, but these simple adjustments, protecting your eyes from the sun, eating healthy foods, and taking care of your overall health, can help you stay ahead of cataracts. These are all proactive steps to help prevent them from becoming a bigger issue. But how do you know when it's time to see a doctor for a more thorough checkup? Topic 4. When should you see an eye doctor? So you've started noticing some changes in your vision, and you're wondering, is it time to see an eye doctor? Well, if you're dealing with symptoms like blurry vision, halos around lights, or trouble seeing at night, it's definitely a good idea to schedule an appointment with an eye care professional. Cataracts tend to develop slowly, and you might not realize you have them until your vision starts to significantly decline. That's why staying on top of your eye health is so important. But here's the thing, even if you're not noticing any symptoms yet, it's still wise to get regular eye exams. Cataracts can form over a long period, and they might not be obvious to you right away. Regular checkups help your eye doctor catch the early signs of cataracts, or any other potential issues, before they start affecting your vision too much. Think of it like getting your car's oil checked. It's way easier to take care of things early on than to wait for a bigger problem to pop up. If you're over 60, it's especially important to stay proactive about your eye health. The risk of cataracts increases with age, and sometimes the changes happen so gradually that they're easy to miss. An eye exam is quick and painless, but the information it provides can make a huge difference in preserving your vision for the long run. Remember, there's no harm in seeing an eye doctor even if you feel fine. It's all about being proactive, not reactive, when it comes to your eyesight. The earlier any issues are detected, the easier they are to manage, whether it's cataracts or something else. So when in doubt, don't wait. Book that eye exam. Now, if your doctor does find cataracts, what happens next? Topic 5. Treatment options for cataracts. Now, let's talk about what happens once cataracts are diagnosed. The good news is, there are options to help you manage or even treat cataracts, depending on how advanced they are. First things first. Not all cataracts require surgery. In the early stages, they can often be managed with glasses, brighter lighting, and anti-glare lenses. For example, if reading is getting harder or your vision isn't as sharp as it used to be, updating your glasses prescription can make a big difference. Anti-glare lenses can also be really helpful, especially if you've noticed problems with night vision or glare from headlights. This might be all you need for a while, particularly if your cataracts aren't interfering too much with your day-to-day life. But as cataracts progress, glasses and lighting might not cut it anymore. That's when cataract surgery becomes a real option. Now, I know surgery sounds intimidating, but here's the good news. Cataract surgery is one of the safest and most routine procedures done today. It's performed under local anesthesia, meaning you'll be awake but won't feel any pain. The surgeon removes the cloudy lens and replaces it with a clear, artificial one called an intraocular lens, IOL. The whole procedure typically takes 15 to 30 minutes, and you get to go home the same day. And the best part is, the success rate for cataract surgery is incredibly high. Over 95% of people who have the surgery report a significant improvement in their vision. Many people end up seeing better than they have in years. The recovery time is quick too. Most people can go back to their normal routine within a few days, though your doctor will probably advise you to avoid heavy lifting and keep water out of your eyes for a short period. It's totally normal to feel a little nervous about surgery, but the process has been perfected over many years, and the risks are very low. In fact, cataract surgery is one of the most common and successful surgeries worldwide. And after the procedure, most people experience a huge boost in their quality of life, whether it's reading, driving, or just enjoying activities without the limitations of cataracts. So while surgery might sound like a big step, it's actually a very effective and safe way to restore your vision. But what should you expect during recovery? Topic 6. Recovery and what to expect after surgery. So you've had cataract surgery, and now it's time to focus on your recovery. The good news? It's usually quicker and easier than most people expect. You might feel a bit groggy from the anesthesia right after the procedure, but most people can go home the same day and start noticing improvements in their vision right away. The best part is that the procedure itself doesn't involve a long or painful recovery. In fact, many people feel good enough to return to their normal activities in just a few days. That said, there are a few things your doctor will ask you to keep in mind during the first few weeks. For example, you'll want to avoid heavy lifting, swimming, and getting soap or water in your eyes. These precautions are temporary, but they're important for helping your eye heal properly. You might also need to wear an eye shield or patch at night for a short period to protect your eye while you sleep. As for discomfort, most people report very little. You may experience mild irritation or dryness, but that's usually manageable with eye drops, which your doctor will prescribe. Speaking of drops, you'll likely be given a schedule of antibiotic and anti-inflammatory drops to prevent infection and reduce swelling. These are super important, so be sure to follow your doctor's instructions carefully. In the days following your surgery, you'll have a follow-up appointment with your eye doctor to make sure everything is healing well. During this checkup, your doctor will look for any signs of complications and will ensure that your vision is improving as expected. If you have any questions or concerns at all, don't hesitate to reach out to your eye care professional. They're there to help guide you through the process. Most people notice a significant improvement in their vision within a few days, although it can take a few weeks for your eyesight to fully stabilize. Patience is key, but trust me, the results are usually well worth the wait. And as you recover, don't forget to keep up with regular eye checkups. Cataract surgery can restore your vision, but ongoing care is essential for maintaining healthy eyesight long-term. Now that you know what to expect during recovery, let's zoom out and talk about the bigger picture, how to protect your eyesight in the long run. So, let's do a quick recap of what we've covered today. Cataracts are a common condition, especially as we age, but with the right knowledge and a little proactive care, you can manage, prevent, or even treat them effectively. We've talked about how cataracts develop, the symptoms to look out for, and simple steps you can take to reduce your risk, like wearing sunglasses, eating a healthy diet, and quitting smoking. We also covered how important it is to get regular eye exams. If you're noticing changes in your vision, don't wait too long to get help. Your eye doctor can guide you, whether that means updating your glasses prescription or suggesting surgery. And if surgery is needed, rest assured, it's a safe, routine procedure with a high success rate, and most people recover quickly with significant improvements in their vision. As for recovery, just keep in mind that it's a short-term process. With a little patience and by following your doctor's advice, you'll be back to your usual routine in no time, enjoying that clear vision you've been waiting for. The key takeaway here is that taking care of your eyes today is one of the best things you can do for your future. Simple steps like eating a nutritious diet, protecting your eyes from UV rays, quitting smoking, and keeping up with regular checkups can make a big difference in your long-term eye health. If you've learned something new from this video, share it with a friend who could benefit from the info, and don't forget to give it a thumbs up. Stay tuned for more tips on how to keep your body and mind in great shape as you age. And of course, make sure to subscribe to the channel for more health advice. Before you go, check out the next video on your screen. It's packed with more essential health tips to help you stay sharp, feel great, and live life to the fullest.